Children's Hospital and Medical Center is one of our community's most treasured assets. My father was fortunate to work with many of the outstanding and caring employees during his 40-plus year career. The Spirit of Caring Nursing Award fulfills Dad's wish to honor and pay tribute to the wonderful pediatric nurses at Children's. Dad was widely admired for his passion and devotion, and in turn he admired the nurses at Children's in whom he put his trust for the care of his patients. The Heart of a Hero Award honors a non-nursing staff member who demonstrates an extraordinary work ethic and caring heart. My father knew that there are many other Children's staff members who make vital contributions to Children's mission and amazing patient and family care. When our family has the pleasure to meet the individuals who are selected for these awards, it confirms the special asset we have in our community. This is a simple way to say thank you for the dedication of the nurses and all of the employees at Children's. The Dr. Robert E. Murphy Awards have come to represent the best of the best.
I have the best job in the whole wide world. Critical care transport is really the best combination of emergency and critical care nursing that I've ever seen.
She was not responsive at all.
You have very intense moments with your patients that you only meet them for very brief periods of time.
As soon as I finish doing this, I'm going to call the hospital, let them know how you're doing, and we'll get you ready to go, okay?
And then you hand them off to somebody else. I think part of the art of transport is knowing that you're walking into a situation where it's often a really difficult day for these kids. I think building trust is really important if you're going to take good care of them and make them comfortable along the way. Getting down on their level, making yourself not so scary, which means being willing to be silly, which is actually probably the most fun part of the entire job. I didn't necessarily grow up thinking I was going to be a nurse. I love science, so I always thought I would do bench science or research of some sort. But then about halfway through school, I took an EMS course and fell in love with emergency medicine. I've traveled around the country since then. I've been a nurse for almost 20 years.
Just that constant education and the constant diligence to push herself proves what type of person she is. She doesn't assume that she knows what's going on, even though she has all these years of experience behind her. It's fun to see her bring it to the team because she has that marriage between the paramedic and the nursing role. She's just great to get to work with. She's kind, she's compassionate, she's intelligent, she's inquisitive, but yet she's so humble.
She treats her patients the way she treats her colleagues and the way she treats people in general. She cares about the human experience, and it's reflected in every move she makes. Emily is definitely a go-to resource on our team. She serves in our shared governance. She's the subject matter expert when it comes to evidence-based practice, when it comes to research. She can go on a call with two partners and take care of a critical patient and bring them back to Children's and have a spectacular outcome, and she'll nominate them for an award. Emily is always shining the light on her colleagues.
She exemplifies exactly what Dr. Robert E. Murphy did when he took the time for the patient at the bedside before discussing care, just to let them be a kid. And she does that.
Just really grateful to the Murphy family. To recognize nurses like this is a gift, and it means a lot to me that people can recognize someone trying to give good care. But I also am very grateful to the people around me that have enabled me to be able to give that good care to a community that bought an amazing ambulance, to a hospital that supports a transport team.
Need to put a whole bunch in here. I knew I wanted to become a child life specialist and work at Children's. Are you going to glue anything on? I think just knowing that the work that we are allowed to do each day with the kids and families is so meaningful, and we know that we make a difference in the care and their lives and their experiences here. Do you want me to open one of the colors here? And so each day and year passes and you just know that you're still doing the right thing and doing what you're supposed to do and what I was meant to do. The children and families that I get to know and take care of are mostly pretty chronically ill kids. Play helps children be at ease and be comfortable. It's what brings joy and it brings laughter. It's an important component. And this one says, "You're a Beads of Courage kid." Beads of Courage is an arts and medicine program where kids are able to receive a beautiful glass bead for each medical care and test or surgery that they do. That's for your poke. And so beads brings joy and it tells the child's story. It tells their medical story. It's very special to me.
Christy was really the primary driver in bringing that program to us and working with another family.
You like that one?
That had experienced it firsthand.
When you guys get home, you can write on the card, Minion 1 means last chemo.
Christy shows compassion every day in what she does. The hematology, oncology, and infusion area is a very difficult area to work in because, of course, you're dealing with a very significant diagnosis on a regular basis. But Christy's heart, her compassion shines through in that she's able to work with those families regardless of what the situation is.
How does it make you feel?
So when you talk about heart of a hero, she exhibits all of those qualities.
So should we count more for blood transfusion? We're going to add to the reds here, okay?
What I love about Christy is that she seeks to really empower our patients, and she empowers them to be brave by modeling courage and confidence. Christy is a very powerful advocate for our patients and families. And I remember a time where she called me and she had some concerns about a patient who was missing some school. She initiated a plan for us to go and visit the school as a team to help problem solve for this patient.
When I think about Christy, I think about all the characteristics like dedication, hard work, enthusiasm, passion.
He's coming.
She has a way of connecting with patients and families that make them feel like they are the most important person in that moment. She's very present, she's very aware. She's one of the funniest people I've ever met, and she always uses humor to connect with people.
It has fish lips. Can you do fish lips?
She's the type of person that if you're having a bad day, she's gonna make it better. And she was the child life specialist that stood out to me as a student, and she's the child life specialist that stands out to me as a young professional. She's the role model that I look up to, that I can say, man, I hope in 23 years I'm doing it like she's doing it.
I'd like to tell the Murphy family that it was a pleasure to hear about their father and what he contributed to Children's Hospital and Medical Center. It's definitely humbling to have been thought of and honored with this award. We all bring something to children's and to the families that we take care of, and to be thought of is quite an honor.